trapezius. I show you the trapezius. This is the big muscles below your nape, and serratus anterior, pectoralis major on the chest, latissimus dorsi, that is below your trapezius muscles, the big muscle there. And then your deltoid located on the shoulder, teres major, and then you have your rotator cuff muscles. This is the location of your rotator cuff muscles. You have your supraspinatus, infraspinatus, subscapularis, and your teres minor. Those are the four muscles that made up of your rotator cuff muscles. This is the muscles that is mostly injured among football player, the muscles of the shoulder. And then you have the muscles of the forearms. You have the brachii, biceps and triceps. Where is the bicep? Here is the biceps brachii, the one on the front, and behind on the dorsal part is your triceps. And then you have your brachialis muscle. This is the small muscles between your triceps and your biceps, your brachialis. And brachioradialis, this is on attach your radial bones, your brachioradialis. And then you have your flexor carpi group. These are your muscles of the forearms. Extensors, flexors, these are your muscles of your forearms. You have your carpal tunnel syndrome in the wrist. What causing the carpal tunnel syndrome is pressure, on the median nerve. People who are always using their fingers, because the median nerve, it branches out the smaller nerves on the fingers. On the four fingers, it branches out. So if this is a very small space, it's called the carpal tunnel. It is a very small space wherein it is irritated when the hands are keep on moving like in typing. It hurts when the tendon is irritated and this area became inflamed or swollen because of the irritations on the surrounding tissue. When this is irritated, when there is a swelling, what will happen to this area? What will happen to this area? If this swelling, what happened to your to your median nerve?
You lose feeling in it, and you lose the ability to grip, and it lets go.
Yeah, it causes tingling sensation, and it causes pain because of increase. When there is swelling here, it will constrict the nerve, and it can cause pain on the wrist, and also it will radiate to your fingers. So that is your carpal tunnel syndrome. The irritation of the median nerve causing swelling on the tunnel area, on the carpal tunnel area, constricting the blood flow, and it causes pain because of the constriction. So what they do is they cut the fascia to release the pressure. For the muscles of the thigh, you have your gluteus maximus, medius, and minimus. These are the muscles on your butt. The iliopsoas, the adductor group, pectineus, quadriceps femoris. This is one of the strongest muscle of the body. And then you have the sartorius. This is the muscle so that you can flex your knee. You can bend your knee. And this is your sartorius muscles, and also the hamstring where you can extend your legs. So you have your quadriceps femoris consisting of your vastus muscles, your rectus femoris. I hope you can see it. So this what compose your quadriceps, your vastus lateralis. This is where we give shots for infant because the muscles that's only developed in infants is the quadriceps muscles. So you have your vastus lateralis, rectus femoris, vastus lateralis. Where's the other one? 1, 2, 3. Where's the other one? It's supposed to be 4. Intermedius. Your vastus lateralis, femoris, medialis. So those are your quadriceps muscles. Sartorius is at the back, and also peroneus longus. This is your hamstring muscle, your biceps femoris longus, your semitendinosus, and your semimembranosus. Functions of your hamstring muscle is what? What's the functions of your hamstring?
It's supposed to be a leg.
Okay, flex the thigh. Flex the legs and the thigh. Extension of the thigh and flexion of your legs. So when this is damaged, you cannot extend your legs. Flex the thigh and extend your legs. This is your, remember this muscle, your hamstring muscle. Remember this. And then the foot, you have your gastrocnemius, and then you have your soleus muscle. The muscles on the side of your leg, on the lateral side, is your soleus. Medial side, the soleus muscle here. And then you have your Achilles tendon. Once the Achilles tendon is tear, it takes a long time for it to heal because of what? Why does it take a long time for the Achilles tendon to heal?
Lack of blood vessels.
Lack of blood vessels. Remember, this is a connective tissue. Connective tissue has a good blood supply except tendon, ligaments, and cartilage. They have poor blood supply. So once this is there, it takes a long time for it to heal because of lack of blood supply. So those are the muscles of your foot. And then these special muscles, these are located at the end of the chapter. Memorize these different special muscles. I'll give this as part of your quiz. By the way, the quiz for tomorrow is chapter 1, 3, 6, and 7, not chapter 8 and 9. I forgot this is your first quiz on A and P. So it's just the introduction. Chapter 1, chapter 3, chapter 6, and chapter 7. That will cover your quiz for tomorrow. For Friday. Do you have any questions? Do you have any questions for your quiz on Friday?
Are there going to be any? It's just going to be questions like normal. There's not going to be any pictures or anything.
No,
it's just.
I will not give diagram. So it's just multiple choice. No fill in the blanks. Okay. Do you want to play Kahoot for these chapters and chapter 8 and 9?
Please.
Yes.
Okay, let's go to Kahoot. We'll take up respiratory system after lunch. Let's play Kahoot.